It's Wednesday, October 9th, and this is the Daily Medical News, where we bring you the day's top clinical medicine headlines, plus a closer look at today's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, using corticosteroids during pregnancy may up the risk of preterm birth in patients with rheumatoid arthritis.
New York declares an end to the Empire State's 2018 measles outbreak.
How this year's Nobel Prize winning medical research could have very real clinical implications.
And there may be an option beyond metformin and insulin for children with type 2 diabetes.
Plus, clinician burnout is linked to lower quality care. But is it actually as bad as some studies show?
Pregnant women taking oral corticosteroids for rheumatoid arthritis may be at increased risk of preterm birth. That's the key finding in a study of more than 520 pregnant women with rheumatoid arthritis. Researchers at Health Partners Institute in Minneapolis found that those taking a daily dose of 10 milligrams or more of prednisone equivalent had a nearly 27% risk of preterm birth. In contrast, women who did not use oral corticosteroids before day 140 of pregnancy had a 2% risk of early preterm birth. Among women with low use of oral corticosteroids, the risk was 3.4%. Among those with medium use, the risk was 3.3%. The researchers found no effect on preterm birth risk from biologic or non-biologic disease-modifying anti-rheumatic drugs, either before or after the first 140 days of gestation. The study appears in the journal Rheumatology.
New York State says all active measles cases related to the initial outbreak in 2018 are over. But the state is now responding to new unrelated cases in 4 counties. State health officials say the new cases are related to measles outbreak exposure from international travel, but they are not tied to the 2018 outbreak. Nationally, there have been 1,250 cases of measles reported in 31 states during 2019. Of those cases, 93% were associated with 22 outbreaks, with the 2 largest occurring in New York City and Rockland County. The CDC says those 2 almost year-long outbreaks in New York put the U.S. at risk of losing its measles elimination status, but robust responses ended transmission before the 1-year mark.
Three physician scientists have won the 2019 Nobel Prize in Physiology or Medicine for their discoveries of how cells sense and adapt to oxygen availability, and their winning benchtop research could generate real bedside therapies. Dr. William Kaelin Jr., Dr. Peter Radcliffe, and Dr. Greg Semenza won the prize for their work describing the molecular machinery that regulates gene activity in response to oxygen levels. The Nobel Assembly cited the work for improving understanding of how oxygen levels affect cellular metabolism and physiological function, and it predicted the research would pave the way for promising new strategies to fight anemia, cancer, and many other diseases. In particular, oxygen sensing is essential for erythropoiesis, so the findings have implications for the treatment of anemia. There are several oral drugs in clinical trials that help stimulate red blood cell production. Dr. Semenza says that may be a great convenience for patients who currently require erythropoietin injections. We'll be back with more medical news after this message.
Adding the GLP-1 receptor agonist Liraglutide to metformin with or without basal insulin cut hemoglobin A1C and fasting plasma glucose levels in children with type 2 diabetes. In the 52-week ELLIPSE study, Liraglutide topped placebo at lowering HbA1c from baseline to 26 weeks, and it maintained that edge over placebo at 52 weeks. The proportion of patients achieving a glycemic target of an HbA1c of less than 7% was significantly greater with liraglutide than with placebo. That was 64% versus 37% respectively. Hypoglycemia rates were higher in liraglutide patients than placebo-treated patients, however. Dr. Timothy Barrett of the University of Birmingham in England was the study's lead author. Speaking at the annual meeting of the European Association for the Study of Diabetes, Dr. Barrett noted there's an increasing prevalence of type 2 diabetes among pediatric patients, an increase most likely linked to the rising rates of obesity. In pediatrics, the only licensed treatments available until recently were metformin and insulin. But Dr. Barrett says the ELLIPSE trial's results support liraglutide as another option to consider.
Burnout among healthcare professionals has been associated with lower quality of care, but is the effect as large as it seems? Stanford University researchers say previous studies have linked burnout and care quality. However, there's been no standardized approach to analyze bias in those studies. So the investigators conducted a meta-analysis of 142 study populations that cumulatively included more than 200,000 clinicians. They found that emotional exhaustion was the primary predictor for lower quality of care in 75 study populations, and overall burnout and depersonalization were the primary predictors for 56 and 11 study populations, respectively. In an analysis of 114 unique burnout quality combinations, 51% showed effects of burnout related to poor quality care, but 43% showed no significant effect. The researchers also tested study bias and found an excess of observed versus predicted statistically significant studies. Given the findings, the researchers say burnout's quality impact in the published literature is modestly strong, but they caution that the true magnitude of burnout's effects on quality may be smaller than reported. And that's it for today's Daily Medical News. Remember to listen to the latest episode of the MD Edge Psychcast podcast, available today and every Wednesday. For MD Edge,
and I'm Nick Andrews. Thanks for listening to the Daily Medical News.